Hello and welcome. Today, we're diving deep into a fascinating and sometimes debilitating condition affecting the inner ear, endolymphatic hydrops. This condition is at the heart of Meniere's disease, a disorder that can significantly impact your balance and hearing. Join us as we explore what endolymphatic hydrops is, what causes it, and how it's managed. So, what exactly causes endolymphatic hydrops? The truth is, the exact cause remains a bit of a mystery. It's considered idiopathic in many cases, meaning we don't know the specific reason why it develops. However, several factors are believed to contribute. These include genetic predisposition, suggesting a possible hereditary link. Viral infections, particularly those affecting the inner ear, can also play a role. Some research points to autoimmune disorders as potential triggers, where the body's immune system mistakenly attacks inner ear structures. Furthermore, head trauma and even certain allergies have been implicated as possible contributors, although more research is needed to confirm these links. Ultimately, it's likely a combination of factors that leads to the development of endolymphatic hydrops. To understand endolymphatic hydrops, we need to talk about the inner ear's intricate structure. Within the inner ear, there's a complex system of fluid-filled spaces. One of these spaces contains a fluid called endolymph. In endolymphatic hydrops, there's an abnormal buildup of this endolymph fluid. This distension or swelling of the endolymphatic space disrupts the normal functioning of the inner ear. The delicate hair cells responsible for hearing and balance become overstimulated and damaged due to the increased pressure and fluid imbalance. This interference leads to the characteristic symptoms of Meniere's disease, such as vertigo, hearing loss, and tinnitus. Pinpointing the exact prevalence of endolymphatic hydrops and Meniere's disease is challenging, as diagnosis can sometimes be difficult. However, estimates suggest that Meniere's disease affects roughly 1 in every 1,000 people. It typically manifests in adulthood, most commonly between the ages of 40 and 60, though it can occur at any age. While it affects both men and women, some studies suggest a slightly higher prevalence in women. Regarding race and ethnicity, Meniere's disease appears to occur across all populations. More research is needed to determine if there are any significant disparities in prevalence among different demographic groups. The signs and symptoms of endolymphatic hydrops can be quite distressing and often occur in episodes. The most common symptom is vertigo, a sensation of spinning or dizziness, which can be severe and debilitating, lasting from minutes to hours. Tinnitus, or ringing in the ears, is another frequent symptom. Many individuals also experience fluctuating hearing loss, often initially affecting lower frequencies. A feeling of fullness or pressure in the ear, known as aural fullness, is also a common complaint. It's important to note that these symptoms can vary in intensity and frequency from person to person, and not everyone will experience all of them. Diagnosing endolymphatic hydrops can be tricky as there's no single definitive test. It usually involves a combination of factors. A thorough medical history, including a detailed description of symptoms, is crucial. Hearing tests, such as audiometry, are conducted to assess the type and degree of hearing loss. Balance tests, like electronystagmography (ENG) or videonystagmography (VNG), can help evaluate inner ear function and identify any abnormalities. An MRI of the brain may be performed to rule out other possible causes of the symptoms. The glycerol test, once used to assess endolymphatic hydrops, is less commonly used now. Ultimately, the diagnosis relies on the pattern of symptoms and the exclusion of other conditions. While the underlying endolymphatic hydrops is the key factor in Meniere's disease, we usually talk about Meniere's disease as being classified based on the stage and severity of symptoms. Early-stage Meniere's disease is characterized by fluctuating hearing loss, often accompanied by episodes of vertigo and tinnitus. As the disease progresses to later stages, the hearing loss can become more permanent, and the vertigo spells may become less frequent but can be accompanied by imbalance. There isn't a strict classification system that all doctors use, but understanding the stage helps guide treatment approaches. Unfortunately, there's no cure for endolymphatic hydrops, but there are several strategies to manage the symptoms and improve quality of life. Dietary modifications, such as reducing salt intake, can help minimize fluid retention in the inner ear. Medications like diuretics can also aid in reducing fluid levels. Anti-vertigo medications can provide relief during acute vertigo attacks. In some cases, more invasive treatments, such as injections of medications into the middle ear or surgery, may be considered to alleviate severe symptoms. Vestibular rehabilitation therapy can help improve balance and reduce the severity of vertigo. The approach is tailored to the individual and the severity of their symptoms. Because the exact cause of endolymphatic hydrops is often unknown, definitive prevention is difficult. However, adopting certain lifestyle modifications may help reduce the risk or severity of symptoms. Limiting sodium intake is often recommended to reduce fluid retention. Managing stress through relaxation techniques or counseling can also be beneficial. Avoiding known triggers, such as excessive caffeine or alcohol consumption, may help some individuals. Prompt treatment of ear infections and management of any underlying autoimmune conditions may also play a role. While these strategies may not prevent endolymphatic hydrops entirely, they may contribute to overall inner ear health. The prognosis for individuals with endolymphatic hydrops varies considerably. Some people experience relatively mild symptoms that are well controlled with lifestyle modifications and medications. Others may face more severe and debilitating symptoms that significantly impact their daily lives. The frequency and intensity of vertigo attacks can decrease over time in some individuals, while others may experience persistent hearing loss and imbalance. Recent research is exploring potential new treatments, including gene therapy and targeted drug delivery to the inner ear. Studies are also investigating the role of inflammation and autoimmune processes in the development of endolymphatic hydrops, which could lead to new therapeutic targets. While much remains unknown, ongoing research offers hope for improved management and potentially even a cure in the future.